Good morning, everyone, and welcome to the National Cancer Policy Forum workshop on innovation in electronic health records for oncology care, research, and surveillance. My name is Larry Shulman. I'm the co-chair of the workshop planning committee. I'm professor of medicine at the Perelman School of Medicine at the Abramson Cancer Center at the University of Pennsylvania. My co-chair is Dr. Mia Levy, who's the chief medical officer at Foundation Medicine. On behalf of the National Academies, I'd like to thank you all for attending our virtual workshop and look forward to 2 days really of very important information on what's really the center of how we practice cancer medicine. The National Academies created the National Cancer Policy Forum to serve as a trusted venue for examining high-priority policy issues in cancer research and care. The forum activities identify opportunities for action to reduce the cancer burden through prevention and by improving the care and outcomes for those diagnosed with cancer. The sponsors for the National Cancer Policy Forum are listed here. I'm not going to call them out individually, but they are incredibly important for the work of the Policy Forum, and we're very grateful for their ongoing support. The Computer Science and Telecommunications Board convenes the nation's foremost computer science, telecommunications, and information technology experts. They provide authoritative advice to the nation on technical and public policy and aspects of IT and its social and economic implications, with sustaining leadership in IT innovation and on using IT in desirable and beneficial ways. Their products include workshops, other public meetings, and influential and widely read reports. Their sponsors are listed here, and again, we're very grateful for the support of these organizations. Next slide. Our workshop goals are really to examine the opportunities and challenges to optimize the functionality and usability of EHRs in oncology care. To that end, we want to discuss potential standardization of oncology EHR documentation that would both facilitate care and communication among clinicians and between clinicians and patients. We want to examine some of the ongoing initiatives to enhance EHR structure and data standardization and interoperability, again, with the goal of improving care, real-world clinical data collection for research and surveillance, and improvement of care quality. We want to consider the opportunities to better align incentives to ensure that EHRs offered by vendors meet these needs of our various users in oncology, and we want to consider policies to foster redesign of EHRs to serve as functional components of surveillance systems to advance oncology care. This is the workshop planning committee. I'm not going to read off everybody's name here, but I would make the comment that this wonderful group of our colleagues have spent countless hours over the last 6 months planning this workshop, and without their devotion and energies, it would not be what it's going to be for the next 2 days. So thank you all. I also want to thank the National Academy staff, Francis, Lori, Rachel, Annalie, John, Erin, and Cheryl. They're an incredible group, and they are the ones that make all of this possible. They keep us all on track. They give us the support and direction that we need to make these workshops successful, and particularly this workshop. The workshop agenda is divided up into 2 days. Today we will go until 5 o'clock in the afternoon, and tomorrow from 9 until 12. Today there will be 4 sessions. Session 1 will be an overview of the use of EHRs in oncology care research and surveillance. Session 2 will be opportunities to improve the patient-facing aspects of EHRs. Session 3, opportunities to optimize the functionality and usability of EHRs in oncology care. And finally, today, session 4 will be a roundtable discussion on innovative strategies to improve EHR data collection to support care quality and research initiatives. Tomorrow, we will have 2 sessions. Session 5 will be the role of some federal agencies to advance progress in EHRs. And then finally, session 6 will be a roundtable session with the moderators from the first 5 sessions. And we will look at policies to foster EHR design to advance progress in cancer care, research, and surveillance. We encourage the audience to be active participants. We encourage you to ask the speakers questions via the chat box. When you do enter questions, we would appreciate it if you would include your name and your affiliation. And for those of you who tweet, we'd love you to share the workshop through the hashtags listed below here. So with that, I think we are going to be transitioning to session 1. Objectives to session 1, but our session 1 will have 5 speakers. First, Mia Levy. I will be the second speaker, Gwen Darien, Shanita Hughes-Halbert, and finally Neil Maripol. The objective, again, of this first session is to review the current state and trends of EHRs and to discuss the evidence base for the design, development of use of EHRs in cancer care research and surveillance. Our first speaker will be Mia Levy. I want to remind you that the presentations will run consecutively, and after the last presentation, we will have a panel discussion, including all of the speakers. The bios for all speakers are available in the briefing book that's posted on the workshop website. And with that, I will ask Dr. Levy, who again is the Chief Medical Officer at Foundation Medicine, who will talk on technical and contextual evolution of EHRs. Mia?